Thank you. Um, Appreciate you joining us today. Uh, the realm of my question is really around the idea that healthcare costs are the most inflationary costs in the 21st century in the American economy, and that time is money. The faster we can do things, so we can lower costs, improve access to consumers. And whether it's moving from prescription to over the counter, whether it's approval of generics, whether it is decreasing the time development and approval process, parallel approval tracks, all of those things. Give me your thoughts on how we can go faster, maintain quality, but also in everything that FDA touches to reduce the cost of delivery ultimately within the economy to our consumers, our patients.
Yeah, thank you for that. I think there's a number of different things we do. For example, on the innovative drug side, when we approve a new molecular entity, a new drug, a novel drug that has an unmet need, it often undergoes priority review. So we speed up that review. And in 2024, we approved 50 new drugs. 52% were for rare diseases. And of those, 56% we did priority review, so shaving off the time. We also realized that our role in this is really to increase competition. So as I spoke, our generic program is very robust, and we seek to get generic drugs on the market by working to provide clarity on the pathway, by working on regulatory science that can make a difference. And then the other younger program is the biosimilar, but we're seeing that accelerate with the number of approvals we have. And again, we've been working on, thinking about this, the biosimilar to interchangeable, that in most cases you don't need any additional study. We're also have convened a meeting with the public and our international regulators to think more on how we can rely on analytic than clinical studies, because we know those take the longest and are the most expensive. So those are some of the areas that we're working on.
And I know that the issue of AI has been discussed in terms of process refinement, but it also that quantum computing and other tools are being used in the healthcare sector to speed development. Do you have any comments or thoughts on that and how that can enhance the time involved?
Yes, we have. Yes, thank you. We do have a program called Model-Informed Development, in which we do modeling and we use machine learning to look at how we can accelerate a review program, maybe looking at different doses through modeling. Our biostatisticians also do a lot of modeling if they're doing, complex statistical modeling to see how we can work on a development program. So we're very committed to using AI. Some of our research, I believe, in the generic industry is also, in generic science program, also focuses on some AI approaches. We can give you more information if you like.
That'd be great. And again, I didn't hear you really touch on generic approval, generics approval of generics and time frame around that. Is there any thoughts on that?
Again, we do have two different tiers in the generic. So if it's a first generic or there's not a lot of competition, again, we do speed up those timelines to really try and meet the need. We've been meeting the timelines that we've agreed with industry, and we will be looking for efficiencies. I think the AI, in terms of summarizing and some of the paper and administrative tasks that are involved, we'll try and work on that.
So I'm going to give you an opportunity to give us some advice. What laws exist that are inhibiting you from going faster, and what should we change?
Well, in the generic industry, I think one thing would be to make the ingredients transparent so that they wouldn't have to ask us the ingredient and the amount. That's what we call the Q1, Q2. I think we've put forth legislation because we often have to go back and forth on that topic. So that would be very helpful. I think, what was spoken about with the skinny labeling is very helpful to give certainty in that area and bring generics. And I think in the biosimilar area, we have talked about not having this biosimilar interchangeable classification and have everything that's a biosimilar be interchangeable. I think that would also be quite helpful.
Great, thank you.
We did have